The way my heart is, it's got an arrhythmic beat to it, and I've got a valve that's leaking, and they won't do anything for you. I've had 5 different heart doctors in Tennessee and in Kentucky, and they all told me the same thing. We can't do anything more for you. So that's why we're here. I have for the last year and a half just watched TV all day long and eat a little bit and watch a little more TV and then go to bed. I just couldn't do anything. My quality of life was just terrible. My son started looking on the computer and found that they make this things in Germany, and we could go up there, and then they checked around and they said, you can come down to the Grand Cayman Islands and we got a man that can fix you up there and do the same thing for you. And it's just a whole lot closer and the weather's a whole lot better. So we just decided this is the way to go.
So my father has heart failure, and that's kind of a downhill slide. So you want to do everything you can to try to help him. He'd had some procedures in the United States, and we wanted to look to see if we could do more. Actually, in the United States, the CCM that he had implanted is just in a trial phase. So we can't have that done unless we meet all the requirements for the trial. And he doesn't meet those, so we had to look elsewhere around the world. Again, just looking what else we could do to help him, help his heart failure, and the CCM was kind of was obvious next step.
Heart failure patients are first managed medically. We start them on medications. Now, when they don't respond adequately to the medications, they have their persistent symptoms, they have shortness of breath, they have frequent hospital admissions, then we have to look at next level of option. This is where the device therapy comes in. The commonest device used is what is called as a cardiac resynchronization therapy. But for this to be used, the patients need to have a very specific form of an ECG, called as a left bundle branch block. And if they don't have this, the CRT is not going to be of benefit. Now, there is a large number of patients with a normal ECG pattern which will not respond to CRT. So it is in this segment of patients that the cardiac contractility modulation comes in.
So we hope with the CCM, and he's already seeing some improvement, but with the CCM, the heart should start beating stronger, and actually it'll change shape. So he'll get a better ejection fraction. His heart will start beating stronger and able to supply blood to his whole body. So it should help a lot.
The most critical part of the procedure of CCM is it consists of 2 leads implanted in critical part of the very important part of the heart called the septum. We have to take a lot of diligence in positioning these leads in the right spots so that the patient can get the optimum benefit. So very briefly, how cardiac contractility modulation works is it delivers what is called as non-excitatory impulses into the heart muscle. So the heart muscle, like a conventional pacemaker, is not contracted by the pacemaker impulse, but its ability to contract improves.
He already has a pacemaker, but they adjusted it. So they adjusted his pacemaker that he already had. It's not even their responsibility. They did that. And then they adjusted his new device, his new CCM, to work with him and with that existing biventricular pacemaker. So he's tuned up. We look forward to improved health. Anyone that needs heart surgery, has any heart trouble, they should consider contacting Health City. Dr. Ravi with Health City, he's a wealth of knowledge. He'll work with you. He's not in a hurry. He takes his time to do everything he can and do it right.
I want to go to the park with him.
Oh, yes.
Good.
We are the only center in Caribbean and South America and the Central Americas. We are the only center doing it. So we hope that this is going to be a nodal center for implant of these devices for some time to come.
If I hadn't had it done and I could do it again, I'd do it the next day, tomorrow. I'd have it done. Because that's how prepared, how I feel like it's working. I would recommend it to anybody that needs a heart procedure. If I have another, this is where I'll go.
Thank you, Health City.
Thank you, Health City.
Thank you, Health City.